Let me talk a little bit about masks that have been very much in the news. Yesterday, as you may have heard, we have a new advisory from the CDC in regard to the wearing of masks. And I know Dr. Acton will talk about this in a moment. Today, as every day when you're seeing this, there's only 4 people in this room. Eric and Lieutenant Governor and Dr. Acton. But for those days that I am in public, I intend to wear one of these masks. These are some that Fran has made, and some other ones that she's made. But you can see 95 masks. They're not what the medical community wears. But I think we should look at them as something that we can do that should be socially acceptable. In fact, when we see someone with a mask like this, whether it's in the grocery store or wherever it is, I think what we should think is they're trying to do something that's good. They're trying to keep their germs. They're trying to keep from infecting us. And so these are positive things. Dr. Acton will explain the limitations to them. What we don't want is people to think that this is a substitute for social distancing. It is not, but it is something that certainly we can do and should be accepted. And if we see someone, whether they're working in a grocery store or wherever they're working, or we just see them outside, we ought to think, hey, they're trying to do something positive. And we're not going to require these to be worn. I'll wear one of the ones that Fran made when I'm out in public. Let me just add a couple things on that. We mentioned the N95 masks, the ones that the medical community wears that provide the very significant protection. Again, we would encourage, John talked about this yesterday, but we had a great breakthrough over the weekend. Battelle is now every single day is sterilizing these. They have agreed to do this for nothing for a couple of weeks. So every hospital out there, we would just encourage you, bring them in. This has a multiplier effect. This means that we can use these up to 20 different times. You'll be able to use them up to 20 times, bringing them in each time to get them sterilized by Battelle. So it's a major breakthrough in Ohio. We are also we're working frankly this morning on procuring more of these, buying more of these, and our goal is to get as many in here as quickly as we can so that we can provide this help. And I know a number of people in the medical community, some of you working in nursing homes, maybe in other positions, need these, you want these, and we're going to do whatever we can to try to get these in to you as quick as we can. And when we start getting them in, we will be announcing that as we move forward. So again, I would just finally say in regard to the mask, we encourage employers, if you have someone in your employee who wants to wear one of these, we would just encourage you to say that's a great idea, and that's a good thing. Lieutenant Governor.
Thank you very much, Governor. Love what you had to say about the masks. I know around our household, we know we're being very careful. Tina, when she goes out and shops for one time a week, she wears a mask and gloves into the store, and we appreciate when we see people in these stores, in the places, wearing the mask because they're trying to do us all a favor. This is not something we should be scared about. It's just something that in society it actually shows respect for one another, that we're trying to do our best to slow the spread. It's just like that. I mean, it's working because that hospital statistic you showed earlier, if we hadn't slowed the spread, that capacity in the hospital system would not have been built, and we would not have been able to handle this. So by slowing it down, everybody's doing their part so that the system can catch up, and literally, in it all together, Ohio is the truth.